Good morning to all participants. My name is Dr. Fazila Ahmad, and I am a medical officer in the Center for Communicable Disease Epidemiology Research. And today I will be presenting a publication paper by Dr. Chong from our center entitled Preparing for and Conducting the National Health and Morbidity Survey in Malaysia Amid the COVID-19 Pandemic, Balancing the Risk and Benefits to Participants and Society. As everybody knows, the novel coronavirus disease 2019, COVID-19, was declared a pandemic in March 2020. This was announced amid our preparation for the Malaysia's National Health and Morbidity Survey, NHMS, which was planned for June to August 2020. This announcement was also done at the same time the Movement Control Order was announced, and for this, we realized that there would be a risk of infection of COVID-19 to the data collectors and participants. The NHMS is a survey conducted by the Institute of Public Health, IKU, which is part of the National Institutes of Health. This was a yearly nationally representative and community-based survey, which was done to generate community health-related evidence to support the Malaysian Ministry of Health in policy making. Our initial planned scope for NHMS 2020 was the zero prevalence of communicable diseases, primarily hepatitis B and C, which was to be the first known nationwide population-based estimate study, in line towards the hepatitis elimination target set by World Health Organization to be achieved by 2030. Our initial method was planned to be a house-to-house data collection and interview, with multiple meetings and workshops planned to prepare for the data collection, data analysis, and report writing. Therefore, due to the COVID-19 outbreak and the Movement Control Order, it led to many uncertainties as to the preparation and planning of NHMS 2020. This also might create participants' confusion and possible reduced response rate, and it also might increase the risk of COVID-19 infection among participants and data collectors. Therefore, the actions that we have made towards NHMS 2020 was to present a new module, whereby we added the COVID-19 seroprevalence and also a facial anthropometric studies, which was to develop a Malaysian respiratory fit test panel. Apart from that, we also reduced the survey scale, whereby the target sample was reduced from 12,000 to 6,000 participants. The duration was also shortened from 3 months to 2 months, and the research team members at each site planned were also reduced. We also adjusted the survey method, which was initially planned to be face-to-face interviews for the COVID-19 and hepatitis B and C module, where blood drawing and interview was to be taken place. So we added a self-administered questionnaire and also computer-assisted telephone interview to reduce the risk of face-to-face encounter and distancing between the data collectors and the participants. Apart from that, all our workshops and training were done virtually by online medium. Before the data collection was started, we screened all our trainers and data collectors for COVID-19 using the PCR and RTK methods. We also initiated a detailed COVID-19 prevention and PPE training module for all data collectors. During the data collection, we set a time limit for the recruitment and interviewing of the participants. We also set appointments for all the participants to come at a designated time so that we could avoid crowding, and appointments were set in an open public place. We also provided face masks and sanitizers to all the participants. During registration, we screened all participants and all data collectors for temperature and symptoms. We also constituted a strict SOP and frequent sanitization of the data collection site. And we did a compulsory wearing of full PPE for all data collectors. We also did a 2-weekly COVID-19 screening of all data collectors for the on-site teams and also screening for all trainers and data collectors before and after each deployment. We did regular audits of the team members and data collectors, and we also did a close monitoring of the national and global COVID-19 situation so that we are aware of any untoward circumstances that could affect our NHMS 2020. Apart from that, administrative infection prevention measures also took place before, during, and after the NHMS 2020. All in all, the outcome for the NHMS 20, we managed to do the data collection from 7 August to 11 October 2020, and this was during the third wave of COVID-19 in Malaysia. We successfully recruited 5,957 participants, and audits that were done within the team members and participants revealed that there was high SOP compliance. And we also would like to report that there were no COVID-19 cases among the data collectors and participants. With 226 team members, we did 492 tests. We also avoided any areas with high COVID-19 transmission or any sites that had an outbreak, and the survey was reorganized and relocated. As a result, we managed to detect 73 previously undiagnosed participants with hepatitis B and 14 with hepatitis C, and these were all referred for further case management. For the NHMS 2020, there were very few detailed literature regarding conducting a population health survey during a pandemic. Therefore, we used the Malaysian national guidelines and WHO recommendations. As such, the NHMS 2020 can be considered a pioneer for a population health survey during a pandemic in Malaysia. Therefore, careful consideration of the risks and benefits to the participants and community should be weighed heavily. Besides that, multiple infection prevention measures with very close monitoring and regular audits are imperative. Strong stakeholder support and strong leadership and cooperation from all the team members are also vital to ensure the success of a field survey during a pandemic. As a conclusion, a national health survey such as the NHMS 2020 conducted during a pandemic will be extremely challenging, but with meticulous planning, it can be successful and extremely beneficial project. Strict principles followed during preparation of and while conducting such surveys can greatly reduce risk and reap multiple benefits of health research to participants and to the society. Lastly, this is the paper and publication that was done by Dr. Chong IKU staff members, entitled Preparing for and Conducting the National Health and Mobility Survey in Malaysia amid the COVID-19 pandemic, which was published in the Western Pacific Surveillance Response Journal in July to September 2021. For all those who are interested to inquire more or to get the full paper, you can access the link attached below. And for that, I thank you.